Hey guys, Katie and Andy here. Hopefully Andy is not too miserable today since I won't be using the Thermomix for this video, but just a little word of advice, if you hear any grunts or weird noises, it's probably just this little boy. He's kind of infamous for doing that. I hope it doesn't bother you guys too much, but this video today will be a quick one. It'll just kind of be a brief background on me, kind of how I got to where I am today, and where I potentially see this channel going in the future. So to start off, if you couldn't tell by my username, I'm a nurse. I currently work in the Texas Medical Center in an advanced heart failure ICU. So essentially, I take care of patients in the ICU that have heart failure, some that are requiring mechanical circulatory support devices such as LVADs, balloon pumps, ECMO, Impellas, and we do a large volume of heart and lung transplants. Buddy, why are you so antsy? Huh? I think we're boring him. I'm going to put him down. So, as I was saying, I work in advanced heart failure ICU, and I'm really grateful for such an amazing opportunity because I had to take off almost 2 years from nursing to kind of go through my own personal health journey. So to kind of expand on that, I ended up having arthroscopic hip surgery back in April 2018 to repair a torn labrum in my hip. The surgeon said it was most likely a wear and tear injury. I was a gymnast when I was younger, and I had an impingement in my hip, and probably over time, the extra bone that was there rubbed up against the labrum and eventually caused it to tear. So I had that done. Surgery went really well. Ended up developing some leg pain, which I thought was probably just related to the surgery. Didn't put much kind of thought into it when I probably should have. But then when I started to notice I was developing some shortness of breath when I was going up the stairs, that's when I was like, something is not right here. So if there's anything that you take away from this video, it's Andy. He's scratching at the door. He wants to go outside. He's like a child. But kind of back to what I was saying, if there's anything that you take away from this video, I hope it is to kind of listen to your body, know your baseline, and if you notice anything that just is not normal or out of the ordinary, go get it checked, because there's no harm in finding out that everything is okay versus ignoring something that is serious and could have devastating effects. I almost didn't go to the hospital myself because at the time, I didn't have, any major health events before all this. So to go to the hospital where I worked and potentially see coworkers and have people my age take care of me, I was embarrassed about it when you really shouldn't be. But I'm really grateful that I went because it turns out that I had a DVT, a blood clot in my leg, that traveled to both my lungs. I had bilateral pulmonary emboli. And I'm really grateful that we found that early on because there's a lot of people that have this diagnosis that are not so grateful to kind of come out of it like I have. So if you ever think something is off, go get it checked. I got treated for that. A few months later, started to notice I felt kind of lethargic, unwell, went to the ER again. I was found to be in a junctional rhythm. I had a slow heart rate that was in the 40s, and it kind of made my blood pressure low. I was having these like near fainting episodes, so I got admitted. I was getting some IV fluids, and then 24 hours later, I went into pulmonary edema, which is I had fluid in my lungs, which made my oxygen low. I was in the hospital for respiratory failure for about 10 days. That was a really scary incident. That's the first time I kind of felt like, am I going to make it out of this? So going through things like this has definitely given me a unique perspective, kind of as a nurse turned patient. At times it's scary. So I've learned I feel what it's like to be a patient and the fears and the frustrations that we go through. But I think it's made me a better nurse and a better person. I just have a different way, just kind of a unique perspective of looking at, nursing or just life in general. So not that I wish anything like this upon anybody, but it's definitely changed the way that I look at life for the better. But to fast forward, ended up getting pacemaker a few months after that to try to help with the, slow heart rhythm and the pulmonary edema. Turns out it's not really helping because I don't have that heart rhythm anymore, but I still go into pulmonary edema. So I'm still kind of on that health journey because it's still happening now. So I think I will also share some of that here on this platform, just my health journey, what it's like to go through some of these things as a patient, and just how our chronic health issues don't define us, that, we still can go out and, be who we are and achieve our dreams and goals. So that's something else that I also would like to share on this channel. And I have an upcoming cardiac MRI, and I have a right-sided heart catheterization that I can kind of share with you guys what it's like to go through that, and share my experience. But kind of back to nursing, kind of how I got to where I am today. I always knew that I wanted to be a nurse. I have a lot of nurses in my family, and one of the things that really left a mark on me was when I was young, my family would help collect gifts for a local pediatric unit at our local community hospital. We would collect gifts, we would wrap them, and we would help Santa deliver them on the pediatric unit. And that's when I saw the bond that these nurses created with their patients, how they just played such a large role in their care. And I was like, that's what I want to do. So I ended up applying to a nursing program my senior year of high school. I applied to one college. I luckily got accepted. And I went into nursing school when I was 18, graduated at the age of 22. I always knew I wanted to do critical care. I was lucky. I had a critical care experience when I was in nursing school. But as a new grad with no experience, it was hard to find a job in general, nonetheless in the ICU. So I'm a firm believer in, if you have an opportunity that's in front of you, even if it's not your dream job, just take advantage of the opportunity. And it might turn into something that you didn't realize. And I'm grateful for that experience. It's made me a well-rounded nurse. I think that floor nurses, especially med-surg nurses, they don't get enough respect as they should. It's not easy what they do, but it's definitely made me a well-rounded nurse, and I'm grateful for that experience. I did that for a year and a half, and then I was given the opportunity to work in a cardiothoracic ICU in New York. Did that for about 2 years, and then that's when everything kind of went on with my health. Had to take some time off to recover, and in that interim was when I met my boyfriend Rishi, who was doing his fellowship in Boston. We met through mutual friends. Everybody wants to know what's like the fairy tale story. There really isn't one. Met through mutual friends, kept in touch, kind of then traveled back and forth to see each other, and a while after that decided to move in with each other. And once Rishi completed his fellowship, he decided he wanted to come back down to Houston, where he was from, and for an opportunity that he had in the Texas Medical Center. So we came back down here together. Houston it's a great city. The med center, there's nothing like it. It's amazing. But the one thing I'll say is the heat, the humidity, it kills me. But I even hear people who live here in Houston, they never fully get used to it. So kind of some other stuff that I will include in this channel. One of my upcoming videos, I think related to nursing, I'll do how I passed my CCRN and my CSC, my critical care certification, and my cardiac surgery certification, how I passed those, resources, kind of tips that I have that helped me pass my first time. I'm also really passionate about like all things beauty and skincare related. I grew up, I had really horrible skin. I took Accutane when I was in high school, when I was in college. You already feel horrible about yourself. And then you have kind of, kids that are saying something about a pimple you have on your face. And yeah, it just really affected my self-esteem. So I've kind of just really invested in my skin, and I've tried different products, and I'll let you guys know what I trust and I use in my everyday life. So if you guys have anything else that you want me to include, leave a comment, reach out to me. I'll also be including, a lot of the cooking and baking recipes that I've kind of been throwing together and share them with you. But anything in particular you want me to talk about, leave a comment, reach out to me. I'll see you guys soon. Be safe. Bye.